And before I begin, can I offer my condolences to the family and friends of Moira McAtee, Brendan Kennelly, Paddy Maloney and Tony McMahon, all pillars of Irish arts and culture for so many years, and their deaths are a huge loss to us all. As Theo Dorgan, another Cork man, Taoiseach, so eloquently put it, we are so much poorer for their absence and so much richer for their lives and for their work. Taoiseach, today the Cabinet has announced plans for further easing of restrictions. COVID is a horrendous virus and it is still with us. Thankfully, our population is largely vaccinated, and this should allow us to proceed safely back to normal. But our healthcare capacity leaves us vulnerable. The crisis that we face now is a hospital beds and a capacity crisis, because science has done its bit, medical professionals have done more than their bit, but your government has failed to step up. Here's the facts. Hospitals across the state are seeing record levels of overcrowding. Our emergency departments are overflowing. The trolley crisis count is rising. It's 416 today. Health waiting lists now stand at almost 1 million waiting for care, and almost 250,000 of those are waiting for more than 18 months. And yet, in the face of this crisis and increasing COVID numbers, the response of your government in the budget was not one single additional inpatient bed. Not one. Taoiseach, how are we to make it through the winter? How will our burnt-out frontline workers cope? How will the health service survive? Your approach means that for the remainder of this year and the entirety of next year, we will have no additional inpatient hospital beds. And are you seriously suggesting that no additional inpatient beds are needed until 2023? Because, Taoiseach, the crisis is now, the overcrowding is happening now, the trolley count rises now, and waiting lists are growing. Phil Nihay of the INMO has said that our hospitals cannot cope today, they won't be coping tonight, and they will not cope tomorrow. This is a very stark warning, Taoiseach, and you need to listen. None of this has come out of the blue. You have to have known that this crisis would hit our hospital hard in the winter time. Indeed, last July, Sinn Féin and our colleague David Cullinan called for planning for the winter to start then. We urged you to prepare for what was to come. We called for an additional 600 inpatient beds and the recruitment of staff to service those beds, and we repeated that call in our budget. But you choose to ignore those calls. You choose not to properly invest in and resource our hospitals, and that leaves us exposed again. And so now the chickens come home to roost, and it's patients and it's hospital staff and it's wider society who pay the heavy price. Taoiseach, tá ar nuspedal faoi bhrú ulwar, ní féidir le déile leis an rú sin, caithfí tú an eistíocht a dhéanamh iontu, agus caithfí tú é sin a dhéanamh anois. Taoiseach, I want you to change direction immediately. I'm calling on you to do that. I want you to provide the investment needed to increase the number of beds in our hospitals, to relieve the overcrowding, and to lift the intense, unbearable pressure on frontline staff who are now beyond breaking point. This must be a central plank in the government's response to the COVID-19 crisis.
First of all, I thank the Deputy for raising the issue, and also would like to join with the House in our sympathies to the late Moira McAtee, Philid and Sco, a dhéan annach their son, or Donna Duchish, and Brendan Kennelly, and Paddy Maloney, and Tony McMahon, artists and musicians who enriched our lives in a wonderful way. May I say, I think the fundamental premise of your question is wrong. The driver of the issue of our responses over the last 2 years in terms of health and public health in particular has been the COVID virus itself and the various mutations. The alpha mutation earlier this year had a very devastating impact on us, and likewise now the Delta variant, which is even more transmissible than the alpha variant, has had a very significant impact globally and indeed in this country in terms of the incidence of cases, in terms of hospitalisation, ICUs and mortality. Now, thankfully, because of vaccination and because of a very effective, efficient and well-run vaccination programme, we have achieved up to 93% vaccination. Vaccines are very effective in terms of preventing severe illness, in preventing hospitalisation, admission to ICU, and in terms of mortality, preventing death. However, over time, in terms of protecting against infection itself, not as strong as it would be in terms of the cases I've just outlined. So therefore, there's a need for a booster campaign, and that's, I think, the key recommendation from NIAC yesterday, which government will implement immediately, will be the administration of the booster vaccine to over 60s, which I think will help us in holding back the impact of COVID. Now, in respect of hospital beds, a total of close to 938 beds are due to be delivered by the end of this year. So you've ignored completely in your presentation the fact that well over 900 beds have been budgeted for and have been provided for, and the follow-through is provided for in this year in terms of the staffing, for example. So that was the largest bed increase ever in 1 year in terms of the hospital capacity. And likewise, in terms of ICU, again, there's a very substantial 25% increase over the last 2 years in ICU beds. And it's close to 300 right now, 321 it'll get to by the end of this year, or at the latest very early next year. So these are very substantial increases in both ICU and in terms of bed capacity itself. But the situation as advised to us by NEFIT is that in all age groups now, people are getting infected. And whilst we are reopening, we are doing so in a very cautious way, with the vaccination certificate at the heart of the protective measures that need to be taken. Now, I know you opposed it tooth and nail the last time when the vaccination cert was introduced in this House to facilitate access to hospitality. You very strongly, you and your colleagues, opposed that, yet it was the key to opening hospitality, and it was advised by NEFIT that that's what we should do, and they are now advising the same in respect of the remaining elements of hospitality. But conscious of the growth in incidence levels, they're very anxious, that is, where practical, and where it makes sense and where appropriate, that a range of protective measures be introduced, the most critical being the vaccination cert be applied across the board, and with due diligence by operators and by consumers also. That's the key issue. But we will be increasing staff again in our health service by another 8,000 this year. So there's going to be no let up in the investment.
Thank you, Taoiseach. McDonald.
Well, COVID is a terrible virus, a terrible sickness, and as I said, it is with us to stay. The level of vaccination at over 90% is extremely high, and as I said, Taoiseach, science has done its job. The medical professionals have done theirs, and your government now needs to do yours. You see, the fact is that the lack of capacity within our health service leaves us vulnerable still. It means that there is a panic right across society when infection levels rise, when hospitalisations and ICU admissions rise, and that is all down to capacity. Now, I put it to you, you did not make additional provision for as much as one new inpatient bed in your last budget. That's the fact. You did make provision for 19 new ICU beds. But that, Taoiseach, is a drop in the ocean. And everybody knows that at the heart of our dilemma now, the highly vaccinated population, with people doing their best and being very thoughtful and cautious, we are still left with this huge vulnerability in terms of healthcare and hospital capacity. The professionals, Last Count Corla, are telling you this, Taoiseach. You know this, it's not just me. So I want to know how you will address that, how we get through the winter, and how you will supplement now hospital capacity. Thank you, Last Count Corla.
255 ICU beds to 321 by the end of this year is not a drop in the ocean. If you know anything at all about ICU beds, it's not about the beds themselves, it's about the entire staffing team that goes behind them. And likewise, up to 340 by the end of 2022. So from 255, that's an enormous increase. over a very short period of time with ICU beds. And then, as I said earlier, over 900 beds to be provided. And what we did last year was, in the funding we provided last year, both for the winter initiative, which got us through last winter, was we provided 2-year funding to enable the staff to be recruited and to enable the beds to be provided, and that you wouldn't have this annual sort of struggle that went on between departments in respect of getting annual allocations. And that has been very, very effective. But other measures have to take place, of course, in respect of diagnostics and in respect of other measures in terms of home care and so on, to make sure that there's a very good, efficient flow so far as we possibly can through our hospitals. But I'll just make one final point, though. The issue about the increase in numbers is not about hospitals alone. That's important. It's about individuals. We want to protect individuals.
Thank you.
That's why you need protective measures
we're over time.
from severe illness and so on.
Sorry.